Hi, I'm Dr. Patterson and welcome to Fasting with the Doc. And in this video, I'm going to share some information with you regarding detoxification. Your body has to be in a state of homeostasis, and the only way to get there or stay there is making sure that the organs of detoxification are functioning properly. And they must function 24/7 in order for you to stay in that state of optimum health. So, and regarding the title, Fasting with the Doc was a radio broadcast that I hosted back in about 2008, where we talked about various health challenges, problems, and solutions to problems regarding your health. But fasting always came up as something that I implemented into the practice about 40 years ago. And the reason doing that made such a big difference was because the treatments that we would render our patients in terms of manipulative therapy as a chiropractor would not hold. The patients would get relief from pain or some sort of strain syndrome or sprain, or maybe they just wanted to feel a little bit better and they could tell that they were out of alignment. And so they would feel much better, but it would not hold. And I found out through their dietary histories that these patients were they were basically nutritionally deficient. They ate well in terms of getting full. The elimination may or may not have been proper, but ultimately they were deficient in the essential nutrients that the body needed in order to develop or stay in homeostasis, which means balance. And so as a result, I started the implement the fasting program. Now, personally, I was doing fasting from 21 years of age. I started fasting with Alvenia Fulton, or Dr. Alvenia Fulton. She was a naturopathic physician on the south side of Chicago, and she kind of helped our family as far as our health naturally. And so I started with her at 21. We kind of met with her when I was about 10. I remember my father and mother driving her up to Michigan. To this day, I can't tell you where we were, but I knew we was in the state of Michigan. And they drove her to see a doctor by the name of Dr. Woods. Dr. Woods was a colon therapist, and she said that the importance of maintaining or regenerating, your health was through the colon. So she believed in that. And I remember my parents received that procedure there, and they felt just like wonderful. So it wasn't until I was able to get into the chiropractic college that I was able to study and find out exactly what was going on. But a lot of information came through her and her radio broadcast. And when I met up with Dr. Allison M. Henson, Dr. Henson was the director of the clinic where I did my internship on the west side of Chicago. And as a matter of fact, Dr. Henson is related to Matthew Henson. So that family has a history of military service and exploration and science. So, but he trained me, and he said to make sure that you keep colon therapy in your practice. Well, I started out like most chiropractors, not something we wanted to perform. And as a result, I had to find out the hard way that these patients needed to have a way to eliminate the waste matter from bad food. And so what we found was that most of the foods that we ate, we consumed too much of it, we consumed it too often, and as a result, the organs of detoxification would not function optimally. And so once you get this back up, at a certain point in time over the years, you will have to see your primary care physician, or you will have some sort of emergency that would take you to the hospital, where you would get that bad news that you're diabetic, you have some sort of gastrointestinal problem. Most of the patients today that we see have reflux disorder. They just eat too much. They're taking all sorts of medications. We have nothing against medication, because medication can handle the emergency situations, but in terms of healing, they don't promote healing in the body. It's something that you would have to do yourself. And so we found out that these patients just basically did not have proper nutrition, and these organs would show up on the adjustments that we would render for the spine. Those areas of the spine that went to the liver, that was one of the main organs of detoxification. The colon is one, too. Low back pain we would see with, especially in females. In many cases, they would come in with low back pain, and when they didn't respond to the adjustment, the first thing I would do was empty the bowel, because we found out that because the pelvis, the way it's tilted, it's in close proximity to the transverse colon. And in many cases, they will have low back pain as a result of constipation or some sort of bowel obstruction. So once we rendered the colon therapy, and in many cases the back pain would go away, or we would have to do two things. That's the adjustment following the colonic, and then the back pain would go away and would stay away for a long time until they came back with another bout of constipation. Basically is what it was. So basically we had to initiate a program where the patients would learn more about nutrition, how nutrition impacts their health. And then one of the main things we had to do was let them know that the body needs a rest. You need to do some sort of detoxification annually. Now it's quite different. We're talking about in the late 70s, early 80s, when I was working with the patients then. But now, 2023, you need to do something major every 6 months, depending on your age. And so we implemented this program into the our therapies, and it has worked wonderful with the patients. So I'm doing this video because what I found is that the patient really just did not know anything or what you need to know about your bodies. And that way you'd be able to have a great understanding as to why we say do these things or don't do these things. See, so that's very important. And then another thing that we noticed too was that in many cases the patients were experiencing the effects of not having this elimination, detoxification. So when you can't eliminate, you can't detox, then a lot of problems as it relates to chronic illness is something that could be cleared up in 30 days. So a person who's diabetes is one of the easiest disorders, chronic diseases that can be cleared up in just 30 days. You can clear it up in 30 days, type 2 diabetes, because it's you have to promote circulation. It's a circulatory disorder as well as a dietary, nutritional deficiency disorder. So we know that structure is function. That's the main thing that chiropractors work with, is with the structure. But anytime the structure is, there's an imbalance with the way your posture is, we can usually trace it back to some sort of non-functioning organ or organ systems. So anyway, the first thing that you have to have is a knowledge as to the organs of detoxification. And there are four. There are four main organs, namely your liver, your kidneys, the lungs, and the skin. And any of these organs could go bad, but they function by detoxifying some substance or some process that's going on in the body. They do the detoxification 24/7. If there's any type of obstruction or delay in detoxification of any of these organs, it could be one or a combination of them all, then you'll start to see changes in blood pressure, changes in your blood chemistry, changes in your weight, changes in your sleeping habits, changes in your hormonal secretions. There'll be a number of things that start to take place, and it's just what we call disease. It's really just a reaction to lack of detoxification of these organs, lack of nutrition in the body. And a lot of the problems, 70% or greater problems as they relate to chronic illness, is due to food sensitivities. You're overly sensitive and don't know it to foods that you're consuming. They're not really food according to the definition of food, but we're talking about highly processed, chemicalized foods that contain chemicals, food that contain pesticides, herbicides. There may be insecticides involved. And so this has been going on for about over 100 years or so. And so now it's beginning to affect the population because you have generational problems because of not being able to properly provide meals, nutritious meals or food for your young ones. And so if they learn from you, we say this is genetic. The cancer societies basically they work on the premise that cancer is genetic. Well, all cancers are not genetic in origin. Surely the genes you may have for cancer may start to show up, but that's usually environmental. So you stimulate this here, or you turn on these genes. Genes can be turned on and turned off. And so that's how therapy should be looked at least in our arena. And one of the other things I want to mention, cancer is a different subject, but we have cancer patients. We don't treat cancer, but what we've noticed is that patients who combine our alternative care, as it's called, with nutrition, some of the other things that we do, incorporating acupuncture, definitely the supplements in terms of herbals, vitamins, and minerals that are designed for that patient's care while they're going through chemotherapy, radiation, or they've had some form of surgery or a combination of those. It's very important to make sure that you have the proper foods, because basically what caused the cancer in many cases is improper dietary habits, and it caught up with you over the years. So, but the outcomes are better, what we've noticed with patients who incorporate the alternative care along, that includes nutrition, along with the oncology care. Trying to do work with cancer strictly on nutrition, it doesn't work. Trying to work with cancer strictly with oncology, I don't know if it's greater than 2 or 3% in terms of successful outcomes, but it's very, very low. It's extremely low. Okay, and so they're saying that you should, early detection is good. Well, early detection for any disease and all problems is important. So, but getting back to nutrition, like I say, a lot of the problems that the patients have is food sensitivities, and they're inundated with chemicals. And I wanted to go over these organs because we talk about the liver. Liver is one of the main organs. Now, I'm going to talk about the colon, the importance of the colon, because I did not include this into the category of the 4, but the colon this is something that's been known in healthcare long before this country even evolved. All civilizations before us, they paid particular attention to making sure the colon was properly functioning in order for them to have longevity or good health. And so, but we'll talk about that separately, but I want to talk about the lungs, the skin, the liver, and the kidneys, and the liver in particular. Now, make sure we talk about the skin. The skin has got to breathe, or there's got to be some sort of exchange of waste matter through sweating. So we recommend that you take sauna baths, or you stay in the sun. You have to sweat these toxins out. If you can't sweat in the sauna, or you can't take a sauna, Epsom salt baths helps to open the pores. That will bring out toxins through the skin. That's very important. Scars are something else that occur. It could be the result of an incision, or it could be the result of keloids. If you have these, they should be attended to, and they could be lasered. Cold laser usually helps to deactivate these scars. We see scars in women who've had episiotomies as a result of childbirth. That's a scar. That should be lasered. And then you want to use wheat germ oil over that scar to keep it deactivated. When I say deactivated, what happens is when we look at the nervous system, the sympathetic nervous system can be in a dominant state as a result of a scar. That could affect your hormones. You might not be able to lose weight because you have scars. So you talk to your chiropractors, because they really are proficient at dealing with something like this here. The dermatologist will look at it not from a perspective of nutrition or deactivating the scar as it relates to the nervous system, but in terms of a dermatological problem, it may even exacerbate the problem, because they may have to do a treatment to alleviate the size of the scar or the incision. So we want to make sure that your sympathetic nervous system is not being affected by the scar. So we do that with laser, cold laser therapy, and just maybe a 1-time or 2-time treatment. But you have to use that wheat germ oil to keep it in that state of neutrality. So that's the skin, and that's scars. Liver is so important, because the liver functions like a dual oil filter. You know, your oil filter on your vehicle, you have one. And there may be some vehicles that have two, but I don't know of any, but usually you have one oil filter. And so this is what the liver's job is, to make sure that anything that comes into the body is filtered, the toxins are separated out from the nutrients and passed on, and it converts it into a more usable form, or a form where it's able to pass out of the body, mainly water. So we have to pay particular attention to the liver. Now, none of what I'm saying is new. This is all old material. The only thing new is you. And secondly, what appears to be new about this is that it's getting much more attention than it got when I first started in practice. Years ago, we would work with a patient and put them on certain supplements, certain diets, certain procedures that we would do in the office to help detoxify the body. Would start to look better. Their lab values would come down to normal. They would go to their PCP, and he would take them off the supplements. And so that became a problem. But now, thanks to you, the public, who started to invest in their health, moving away from so much medication. We're not against medication. Medication has its place. Surgery has its place. As a matter of fact, the slogan in chiropractic is chiropractic first, drugs second, and surgery last. And so we want to leave that as a last alternative. However, we ran into this problem, and what happened was, since 1992, you, the patient, started to look at other avenues, because you started to notice that your parents or grandparents, or maybe siblings or people in your family, would succumb to and have certain disorders as a result of some sort of problem with their diet, or some sort of problem or deficiency as a result of poisoning with food. Now, when I say poisoning, the accumulation of toxins as a result of these organs that I mentioned that didn't work properly. See, so they would accumulate, but giving them drugs would make the pain of the situation or the problem, it would resolve that, but not in terms of resolving the problem. It wouldn't resolve the underlying problem, which was toxic buildup. So we took care of the scars, we took care of the skins, we were on the liver. The liver is so important because it has a dual function. So I just want to go through a couple of things. You want to make sure that there's two phases in liver detoxification, phase 1 and phase 2. Many drugs affect this process, but what activates phase 1 detoxification? I just want to read this to you, because every chiropractor knows this here, and especially those that work with nutrition. But steroids will activate or turn on phase 1 detoxification. Alcohol. Right away, your body has to get that alcohol out the system. Sulfur-based bacteriostatic antibiotics. Believe it or not, the antibiotics will help with the infection, but it also turn on the detoxification process. That's important. Cigarette smoke. Cigarette smoke is a poison. It's a toxin, so that would turn on. High protein diets. You know, the carnivore diet is good for losing weight and whatnot, but certain people, namely African Americans, cannot tolerate high protein in their diets. You don't necessarily have to be a vegetarian, but extremely high intake of protein, it would have to activate this detoxification process, phase 1, in the liver. Otherwise, you would have problems with this, with your kidneys, with the high protein. Pesticides, exhaust fumes, charcoal grilled meats. We notice that our patients who are during the summer months, when the holidays are really in force, you know, they start with Easter, with the Easter dinner, but the next holiday coming is Memorial Day weekend, so that now we're grilling meats very heavily. Then you have summer vacation with graduations, weddings, celebrations. You have family reunions and the 4th of July. That's one of the main meat holidays that we have. It's we're grilling, and so your liver must be working. But if you typically follow the pattern of the Americans in terms of the diet, you have charcoal grilled meats, You have alcohol consumption. There's cigarette smoking. So the diet is very high in protein. There's hardly any vegetables at events like that. So now we got phase 1 detoxification taking place. And the problem with that is that we eat too much of this food and we eat it too often. And with that, there's heavy metals. And we do know that 80% of all your heavy metals, that could come from, wrapping foods and aluminum foils, certain pots or utensils that we use that are not that aluminum based. So the heavy metals that come from that have to come out through the colon, at least 80% of it. So we're going to talk about the colon in a little bit, but that's not going to be one of the main organs of detoxification that we are going to label. So I want you, before you start to detox, you have to know the organs involved. Your lungs are involved. You have to have that proper respiration. If you notice, the lungs are under attack in this time that we're living in right now. There's all sorts of pollutants in the air. You need your lungs in order for you to live. It's amazing to me how many pollutants are in the air from industrial waste that's being put in the air from all sorts of industry. Now we have fires that are polluting the air, not to mention exhaust that's polluting the air. And there are things that are airborne that can cause problems with your respiration, and this will cause problems to your health. But the thing that I'm looking at is damage to the tissue, to the bronchioles, the alveoli. Once you damage that, it's very hard to reverse that process. Then the next thing is the kidneys. Your kidneys, you must protect these. And during the detoxification process, we recommend certain supplements that protect these organs. You cannot, in today's world, it is impossible to detox the body without eliminating waste matter from the colon, through the skin, making sure that you have proper filtration through the kidneys. Kidney function has to be at optimum rate. The liver should be functioning, and the lungs should be functioning at high levels. And when there's damage, then you have to supplement the diet. We're not talking about cure. We're talking about reversing disease processes, reversing the flow of waste. We're talking about drainage. These organs must drain this waste or these toxins out of the body that has accumulated. And the only way they can do that is to have support and for you to reduce your caloric intake to the point where you're not, it should be at least under 400 calories a day in order to properly detox. The best way to do that is with water, a water fast. So we'll talk about fasting separately, but I want to focus on your liver again. So we talked about phase 1 detoxification, the things that stimulate phase 1 detoxification. What about things that inhibit the detoxification process of the liver? The liver is very important. What about antihistamines? Patients who have sinusitis or certain problems where they have histamine reactions, they're taking antihistamines. That would slow down or nearly stop phase 1 detoxification of the liver. Stomach blocking, secreting, or stomach acid secreting blocking drugs. Okay, these are things that you take. Say, for instance, you're diagnosed with GERD. Okay, so you want to slow down the acidity that's in the stomach. But that also, it would take care of that problem, but it would also inhibit the function of the liver in terms of phase 1 detoxification. Sulfur-based bacteriostatic antibiotics. We see, chiropractors will see this a lot because a lot of patients will come in on antibiotics. And if you administer colon therapy, you'll notice a difference in that patient's return or excretion. See, benzodiazepines. This is a drug. We see this quite often, or this classification of drugs, based on the fact that patients may suffer muscle spasms. They've been involved in a motor vehicle traffic accidents. They will probably have muscle spasms, or they will have some sort of pain as a result of trauma. It could be a fall down a flight of stairs. It could be lifting something too heavy. So they're given that. You may see patients will take that for seizures also. But what happens is that it impairs or it inhibits phase 1 liver detoxification. Another thing is grapefruit juice. Can you imagine that? Years ago, there were hardly, and I'm talking about back in maybe the 30s, you had very little weight loss clinics or places that dealt with weight loss. I remember my mom and great aunts and grandmothers saying that they just ate grapefruit for 3 days and they would drop down an entire dress size. So can you imagine that? Now, grapefruit is something natural, is good for you, but grapefruit juice or grapefruit inhibits phase 1 detoxification process. And where do you see this? You see this in patients who are on statin drugs. Normally it doesn't do that because it's a natural fruit. So, but if you're taking statin drugs to reduce your levels of cholesterol, one of the contraindications are grapefruit and grapefruit juice. When there's reduced blood flow, when there's slow circulation or poor circulation, this will also inhibit the function of the liver as it relates to phase 1 detoxification. And then, of course, nutritional deficiencies. And so this is why we have to support the liver. You have to, when you detox, you have to support a few organs. You have to support the heart, the lungs, the kidneys, the liver, and offer support to the kidney. So when we talk about phase 2, now, so it's going through 2 phases. And so basically when there's a problem with any one of these phases or a combination of both, this is where your cancers develop because you develop the formation of free radicals. See, so in that process of detoxing something from the liver to the kidney, free radical formation may occur. If free radical formation or free radicals are not put in check, then you may see certain cancers develop. And it takes a long time, but it does occur. So when phase 2 occurs, what we're talking about is binding up or conjugating certain substances and turning them into water. Now, what foods will do this? That's cabbage, Brussels sprouts, beets, asparagus, kale, things of that nature. These are they're sulfur-based vegetables, and they help to this phase 2 process to take place. And so what phase 2 does, it really helps to make the primary toxin or metabolite water soluble. So that means that the kidneys now will come in. So through the kidneys, you urinate this toxin out. You can sweat it out. Some of it's going to go through the colon. It's going to go into the circulation, into the lymphatic system. It's going to go through the kidneys, but that water contains the toxin, and you have to urinate that toxin out. And so when this occurs, then basically these organs will start to detox without your knowledge. You should be able to eat without having to worry about whether or not these organs are functioning. You have to eat the right foods, or you have to have the right or proper supplements to handle any deficiencies that occur. Now, there's certain conditions that are more prominent in different groups, different races, different gender. These are all addressed. And what we found is that when you fast, if the fasting is medically supervised, you want to make sure that you have a physician or a person who is very knowledgeable and have some clinical experience. There are many people who have a zeal or a zest because of their own personal experience that was very good, and they will start to work in this area, but they give out partial information. And some of the information may be detrimental to a person who's looking for treatment, to utilize as treatment, because they have no clinical experience. And so with clinical experience, you'll find out, the practitioners will find out that in a small percentage of patients, doing everything right will not work for them, and they have to have other forms of intervention, care, to help them through the process. They can get through the process, but they have to have help. So one of the things that you should do, once you get, you become aware that these are the organs that are involved, now to proceed with the detoxification process, you need to have your primary care physician do your lab work. That's very important in us with our test to determine what supplements you need in order to protect certain organs through this process. And so have your doctor order an NMR lipid profile, because this gives us information about the cholesterol. That's very important, because you may have a heart condition where you will not be able to participate in a detox program as strenuous as a water fast. Or more importantly, it'll give us information concerning the lipids and what supplements we need to help the liver detox or balance this, because it's all about balance. It's about homeostasis, and we want your triglycerides, your LDL, HDL, and cholesterol levels to return to normal if they're elevated or out of balance. And so that's what happens when you go through a fast. So you want to order that test with your through your PCP. So the thing that you should look for, and I'm really speaking to patients who do not have access to traditional medical care for whatever reason. We have patients who have certain reasons that they don't go to the doctor. They're valid for that individual. We're not dismissive of those reasons. We do recommend that they go, but in the event, there's some patients who simply just do not trust. There's a trust issue with the medical profession. I don't feel that that's a valid reason, but it may be valid for you. I think that you should try to find, so that means that you have to intensify your search. There are doctors out there who are intent on performing a service to help you get better as far as your health is concerned, or maintain good health once you attain it. So you should do that. What has happened is many of you are referring to the business of healthcare, where you see these corporations taking over the healthcare industry. And so that leaves the independent thinking doctor at a loss, because they're buying out some of these clinics. And there's only a handful of doctors, when you look at the overall picture, the whole overall scope of medical care, where the you have doctors who can think independently and look at you as an individual and not as fit you into a group where a protocol is used to treat this particular diagnosis or a group of diagnoses. That might be good in a setting where there's an acute setting where there's medical intervention needed. However, I'm speaking to the patients who's looking to work with themselves. They can afford to have certain tests run independently. They're looking for a evaluation of that, and they want to start their own program. They want to make sure that they can ensure that their health will improve. They want to reach homeostasis, which is balance. And so they need help in this area. You'll find that in many of the patients who are like this here, they don't have insurance. Okay, so these are patients who pay out of pocket. I'm going to tell you, what we've seen and encountered over the years, the patients who have insurance are the sickest patients. They have more problems. They have to have more visits to the doctor, yet they have coverage. And the coverage is good because they have high medical bills. But the patients who rely on cash as their form of payment, they have a tendency to take better care of themselves. They have less problems. If they have a major issue, that would send them to traditional medical care. So we look at these patients. We're trying to help these patients because they know that in order for them to perform their function, they have to be healthy. They're looking at longevity, and they're looking to do whatever it takes to maintain health. And so the diet is important to them. Their elimination is important to them, and whatever they need to take to make sure that they can reach that point where they have optimum health, that they're willing to do. They're much more compliant. And so we know that with education, which is the reason why we've done seminars, we've done radio broadcasts, we have newsletters that go out to our patients. The education helps the patient focus a little bit more on their health, and they are the most compliant when it comes to having therapy rendered onto them. So that's important. That's one of the reasons why we're doing the video. But I want to kind of wrap it up with the large intestine because, like I said, none of the information is new. This is old information, and it has been monetized by the powers that be. And so that's why you see more information on supplement use, herbals. I'm telling you, this stuff has been around before there was the United States of America. So you will hear saying that food is your medicine. Food is your medicine is a term that was used in Africa before Hippocrates. So they believed in using herbs and mixing herbs with the proper foods to handle any type of malady. The diets were different. I'm going to talk about in the future, which is going to really have significance as to why are you really sick? Okay, what makes people sick? It's not just the food. Food is one of the reasons that they're sick, but truly, why are you sick? You know, why do you have these conditions? Where did these conditions come from? We talk about remedies and how to handle this, but you don't talk about why you come down or contract certain illnesses. Now, we're not talking about accidents, falls, sprains, strains. That can be handled. But we're talking about chronic illness, which makes up about 70% of all diseases that are seen in this country. Why are you sick? So we'll go into that because it'll surprise you. The reason why you're sick will surprise you. So back to the large intestine. Okay, I held that back as one of the organs that we talked about the 4 organs of detoxification, but I held back the large intestine because the large intestine collects the waste matter. It collects, it's about 5 feet, 2, 3, 4 inches long, 2 inches and a half in diameter, and it can swell even larger, like 4 inches in diameter if it's full. And one of the things that you don't want to do, and we've seen this in patients, this colon, the esophagus, stomach, small intestine, large intestine is what we call a tube within a tube. Your body, this is the outer tube, has inner organs, and from here to the rectum is another tube of varying sizes and varying lengths. And so what goes in here, what happens is that you're supposed to have processes along the way, just like a highway, that help to break down the bolus of food into its component parts and send it to the proper pathways to give you energy. A lot of these processes that take place, they all require amino acids, they require vitamins, minerals, fats, you name it. They require all those things. They're missing. And when they're missing, you cannot complete the process, or the process will be deficient. And ultimately, people die from only 3 things. We die of starvation, we die of exhaustion, and exposure, And so starvation, regardless of what the death certificates say, at some point in time along the way, this patient was starving. They was nutritionally deficient. They may have been exhausted, fatigued, overworked. They may have been suffering with exposure. It was exposed to something. So they may be 1 or 2 of these things, or a combination of all 3 that's incorporated into the demise of the patient. So we're not talking about the actual procedures and process, but we're talking about 3 things that's the reason that people ultimately die. So when we look at the large intestine will house the waste. You should never be full in your digestive tract with food. I'm talking about the stomach, which takes about 4 to 5 hours to empty once you complete a full meal. The stomach should empty into the small intestine, the duodenum being the first part of the small intestine. So there's 3 parts, your jejunum, duodenum, and your ileum. And so they are digesting, breaking down different types of foods that go into the body, specifically certain types, groups in the area of carbohydrates, fats, and proteins. And so what's left, what's undigested, moves into the large bowel for elimination, where you should have a lot of water because the reabsorption of water occurs there. So what we found was that patients come in suffering from constipation. Constipation is defined as a passage of a dry, hard stool. So it's not the absence of a stool, it's the presence of a dry, hard stool, or passing of a dry, hard stool. So you can be going every day, but if the stool is dry and hard, you're considered constipated. And the biggest problem I've seen with patients consuming foods is the overconsumption of foods, whereby you have food waiting to be digested or being digested in the stomach. Food from previous meals in the small intestine. The small intestine is 20 to 25 feet long. And so why are you still eating when you have food, 25 feet of food in your small intestine? Then you have food you haven't eliminated or eliminated the waste of the bowel, the large intestine, the large bowel. That's 5 feet long. So you have nearly 30 feet of undigested stew and food mixed together. And then you have food in the stomach waiting to move into the small intestine. And worse than that, this person, since they're nutrient deficient, is hungry. So what they're doing is they're looking for another meal. So they're going to force food in, even though the body really can't handle any more food. This is the biggest problem. And so before you embark on any form of detoxification, any form of dietary restrictions where your caloric intake is 400 or less, you need to evacuate the colon. You must. It's imperative. It's incumbent upon you to open the bowel up and eliminate that waste matter. So we don't just put a patient on a water fast right away. We have to prepare your body. You should start preparing your body with structure, making sure that the body has been properly aligned. So you need about 4 adjustments, 4 alignments prior to starting this detoxification process, because many of the times when the body, like I said in the beginning of this video, a lot of malalignments or misalignments are due to, or structural deformities is really due to nutrition deficiency. So line the body up. You'll see that once you get the alignments, and we over years figured out that you need at least 4 prior to embarking on the detox program or the fast. You need at least 4. Make sure this aligned. It should be in close proximity to the time that you're going to start or embark on this detox program. So you start with 4 adjustments or alignments. Then you need 5 days, 5 to 6 days to prepare the body for a water fast. So I didn't go into the other detoxification processes or programs because they all work. They all work on somebody. All diets, weight loss diet, they work. They all work. They work on somebody, but they're specific to a certain body type, a certain group of people, a certain gender. So we'll talk about that when we get into what actually or what really makes you sick, because you, like I said, you'll be surprised why these things work for some and don't work for others. But in order to work properly with a person who is embarking on a detoxification program, and it includes a water fast, we're talking about a 30-day water fast, so it should be medically supervised with a person who is knowledgeable in the body from nutritional perspectives and regeneration, functional medicine. You should work with a doctor like that. You have to prepare the body first, okay? And so you have to have a personalized preparation for that body. And this is why your lab results are so important. There's certain tests that your chiropractor will do to help them a little bit more in assessing what type of program to put you on and which direction to go in terms of the water fast. So we prepare the body the first 5 days. Never, never, ever on any program change, any body change without evacuating the waste matter in the colon. So the fear has been for years with colon cancer going up. The fear has been colon colon therapy, colon hydrotherapy. Colon therapists, they have saved many lives without being credited, because patients, for whatever reason, may not go to their primary care physicians properly or in a timely fashion, or they're taking so many drugs, they may not want to go. They may not want to hear what the diagnosis may be, so they go to a colon therapist, and that helps them. It doesn't cure all things, but it has put a lot of people in the proper directions, on the right path to restoring their health. So I urge you to make sure that before you start or embark on any program, any change of diet, make sure you have your colon flushed. Colon therapy is number one in my book. Enemas, herbal teas, laxative teas. You can take 2 tablespoons of castor oil. You notice everything that I talk about, you don't like. Patients, they don't like castor oil. They don't like colon therapy. They don't like enemas. They may take a herbal laxative in the form of a couple tablets, or capsules or what have you, but you don't particularly like the process by which you can attain optimal health. And that involves enemas. It involves colon therapy, colon hydrotherapy. It involves herbs and minerals and some vitamins. See, so we see colon cancers on the rise. Why is it on the rise? Because your body is holding on to this waste matter too long. The toxins are being reabsorbed back into the body. You may have leaky gut syndrome. Leaky gut is just about everybody who eats highly processed foods. So the gut is going to leak that waste matter back into the bloodstream. That's where a lot of your autoimmune diseases come from. So patients with lupus, they need colon therapy. They need something. They need to restructure the colon. They need to heal the colon. So, and that's the case with all your conditions, all chronic illnesses. Many of the autoimmune diseases have a foundation or basis in the colon. Rheumatoid arthritis. You'll be surprised at how the colon plays a role in deformities of arthritis and the deficiencies that we see in rheumatoid arthritis. But anyway, getting back to the detox in the form of fasting, patients who, and I just want to throw this in too, patients who are, they've converted, they decide, I'm going to go on through and become a vegan or a vegetarian. If you cannot maintain a vegan diet and you cannot maintain a vegetarian diet, the pure reason is that your colon is full of waste matter. And the reason you come off, or the reason you have symptoms, is because you're reabsorbing. You have a leaky gut situation going on. You're reabsorbing the waste matter that should have come out when you altered the diet. And 9 out of 10 times, what did you do? You took out a lot of the processed foods. You took out foods that contain chemicals. You got rid of food sensitivities through elimination, foods that your body did not want. So when the body can't process something, it will give you a reaction to let you know. It's a warning. That's all it is. Don't take medication for that. Find out what it is that caused reaction, clean it out of the colon. See, and don't put it back in your body again, or change the purity of that particular food item that you have a sensitivity to. So, but when your fasting is personal. It should be personalized to you. So you have all your tests that you've taken. The doctor should help you prepare those 5 days where you're eliminating this. It's all water-based, it's herbal-based, before you can move into the actual water portion of the fast. And so you should have a colonic at the beginning, after you had your 4 spinal alignments. You should have one day 6 when you embark on, if you start your water portion of your fast. And so if you start water, you should be taking the herbs that support the liver, the lungs, the kidneys, the skin, and the heart. And then whatever herbs to support any type of problem that showed up on these tests. You want to support the organs that are either deficient or overstimulated, and see meridian energy analysis test is something that you'll see with mainly your doctors of acupuncture, your medical doctors who are into restorative or functional medicine will perform this test, and it'll give you the function of organs in terms of the energy of the organs. Is it low functioning in energy, or is it hyper functioning? Is it over functioning? So you can incorporate that into the test from your PCP. And then that'll help you formulate, the doctor will formulate a program for you to fast where you'll get through this fast with no problems. As a matter of fact, you'll have more energy. You'll balance the hormones in the body. You'll balance your autonomic nervous system. That's your sympathetic and parasympathetic nervous system. You will balance the your chemistry, your blood chemistry. We're talking about your cholesterol, your HDL, LDL. They will come into balance. Your liver enzymes, ALT, AST. These are liver enzymes. A lot of times when these enzymes are elevated, you have some sort of liver problem, a liver disease, or some inflammatory process in the liver. It will balance all of those. Even with the kidneys are a little slower to change with the fast, and so you have to be careful, especially with African Americans. The best thing you can do is to go on a fast, but it has to be supervised. You want to make sure your GFR, it'll come back to place, and more than likely, you will have to take the herb to support the kidneys even after you complete the fast. So these things are important. And once you complete the fast, you have to reintroduce food back into the diet, and it cannot be the foods that cause these problems that you presented with in the very beginning. You must alter the diet. You must put in foods that are going to support these systems and all of the other systems in the body. So I urge you to make sure that you can find put together a team. In one of the videos I put on Instagram, you can go to Instagram and see some of the posts that we put there. Just go to Dr. Ferris Patterson, DC, and you can look up some of the things that we posted to kind of help you as far as your nutrition is concerned. And it will cover structure. You'll see the importance of manipulation. You'll see the importance of foods. Where do you get your foods from? The person who raised their own food will get a better grade or quality of food, void of chemicals. You know, the processing of food is what's really hurting you more than anything else. And so go there and you will get that. And then here on our YouTube page, we'll put a little bit more information in this format to help you and guide you to better health. So with that being said, I'm going to talk about a little bit more about the large intestine in the next video. And I want to give you some information as to why and how we get sick. Why do you get sick? You'll be surprised to know why you really get sick. Okay, in closing, best in health.